Hey, good afternoon, everybody. This is Brittany Jennings coming to you live from the Seniors Blue Book. We are live via Zoom today, and I am joined by Cammie Aldridge, the SHINE Program Manager from Area Agency on Aging for Southwest Florida. Good afternoon, Cammie.
Good afternoon, Brittany.
And I said that all in one mouthful, and I'm super proud. So it looks like you're hanging out by the Golden Gate Bridge. What's the weather like out there today?
It's sunny.
Well, I appreciate you joining us today. I know a lot of people are definitely interested in this topic and finding out, resources and information about Medicare, so pertinent to everything that's happening right now. But first, I really want to talk about the SHINE program. Could you kind of give us an overview of what you do on a normal day basis?
Oh, sure. So the SHINE program is through the Area Agency on Aging for Southwest Florida. So if you're living in Southwest Florida, it's presented to you through the Area Agency on Aging for Southwest Florida. And once I get into the presentation, I'll give you more details about that. We do cover 7-county area, so Sarasota, Charlotte, DeSoto, Hendry, Glades, Lee, and Collier. And we have volunteers in each of those counties that provide the direct service.
Awesome. Well, I know from my experience, you guys have been such a fantastic organization. My entire career has basically been assisted living world, and you guys do such a great job of help regulate and take great care of our residents. So thank you for everything you do.
Oh, thank you.
So without further ado, I'm going to hand it over to you and let you discuss all the updates. I know you have a lot of great information for everybody. So let me go ahead and I will do this here, and I should be able to. This is something new for me, technology-wise. Here we
I've
go.
been practicing.
All right, I officially made you the host.
Okay, perfect. So I am going to share my screen just to walk you through the presentation. And even though I'll be presenting on SHINE, which is Serving Health Insurance Needs of Elders, it's actually a program through the Elder Affairs, and it comes to us through the ADRCs. So I'm going to get into that detail in a bit. So SHINE is a national program. It's part of the SHIP organization, that's SHIP. So if you're from another state, you might be more familiar with SHIP. It's the same thing. It's just that in the state of Florida, the SHIP, SHIP acronym is used for another housing program. So we weren't able to use that acronym. So SHINE, Serving Health Insurance Needs of Elders. And the mission of SHINE is to provide a service that is free and unbiased to every Floridian. The program itself comes from the Department of Elder Affairs, and their mission is that all Floridians age with dignity, purpose, and independence. And like I said before, the SHINE program is free, it's unbiased, it's offered to every Floridian, someone that is eligible for Medicare, whether through disability or age, is eligible to receive free service through this program. So how the program works, the funding comes from the federal government. So it comes from the Administration for Community Living, and it's disseminated to all the states. And we're going to focus on Florida because that's the state we live in. So it goes to the Florida Department of Elder Affairs, and then it's funneled through to the Age and Disability Resource Centers throughout the state of Florida. And in the state of Florida, there are 11 Age and Disability and Resource Centers. And we're in Southwest Florida, so we're right here in purple. We're the Area Agency on Aging for Southwest Florida. But there are other areas throughout the state that provides the same service that the ADRC or the Area Agency on Aging for Southwest Florida does. And each of these 11 areas also have the SHINE program, and they have very similar structure, providing the same service through volunteer pool. So I'm going to get into a little about what the Area Agency on Aging for Southwest Florida does. And like I said before, it might be a little bit different than the other 10 partners that we have throughout the state of Florida. The Area Agency on Aging for Southwest Florida is a not-for-profit organization, so it's a 501c3 organization. The mission of the agency is connecting older adults and adults with disabilities to resources for assistance so they can live safely with independence and dignity. And we serve a 7-county area: Lee, Collier, Charlotte, Hendry, Glades, Sarasota, and DeSoto. The services provided through the Area Agency on Aging, they're not limited to the ones listed here on the screen, but I highlighted the ones that we normally get referrals through our elder helpline on a daily basis. So there's the Elder Disability Program, Assessment and Intake, Emergency Home Energy Assistance Program, or EHEAP, the community-based program, which a lot of our seniors come to our agency for. This is where the assessment for the Medicaid waiver is done. The priority wait list, it's all managed through the Area Agency on Aging for Southwest Florida. We have health and wellness programs, elder abuse and prevention, and education, the veteran-directed program, and of course, our beloved SHINE program that I'm going to focus a lot on in the next few slides. So going back to one of our last few slides, I jumped over the section that spoke about SHINE volunteers. And that's what the program is. We manage the program, but the actual outsourcing of the program or the work of the program is done through a dedicated team of volunteers. These volunteers have retired from the highest level of their profession, and it's just a wonderful way for them to give back to their communities. And since it's still Volunteer Recognition Month, I'd like to have a big shout out to all our volunteers across our nation, and especially our SHINE volunteers here in Southwest Florida, that they do such an awesome job for our program. So a little bit about what the SHINE volunteers do. They manage or discuss all the pertinent parts of Medicare. So from when someone is eligible for Medicare, the various parts of Medicare, where they enroll in Medicare, and that enrollment is done through Social Security. And then most folks start out with parts A and B, and then move on to whether or not they want to get a Medicare Advantage plan. There's also the standalone prescription drug plan, and that goes along with original Medicare. There's Medicare supplement, also goes along with original Medicare. And then for those folks that have some financial need, they're not able to pay the full cost of their Medicare Part B premium, they're on the lower income spectrum, there are 2 financial assistance plans. The first one is Extra Help, that is through Social Security, and it provides help for those folks that need assistance with prescription drugs. And they can get that assistance whether they're in a standalone Part D plan or an all-inclusive Medicare Advantage plan. And then the second piece is the Medicare Savings Program. And this program allows folks to get assistance with their Medicare Part B premium. And if they qualify, they could qualify for up to co-insurances and deductibles being paid for this plan. One important piece that I jumped over just so I could relay both financial assistance piece is the Medicare fraud and abuse. that is covered through a new program that Shine retained, gosh, maybe a year and a half ago. And it deals with Medicare fraud and abuse. And we have seen great success with this program since the Florida Department of Elder Affairs wrote the policy mid 2018. Another program that our volunteers assist with is the long-term care planning. And this is not your long-term care insurance like you see through Medicaid. This is different. This is where folks who prior to retirement or just after retirement purchased long-term care policies for benefit that can be provided at a later date. And I'm not going to go into much details on that because that's a complex area all on its own. Then there is Medicare complaints and appeal. And this could range in from someone being improperly billed at their physician's office to I enrolled in Medicare and all of a sudden I have a bill for my Part B services and I don't know why my Part B premium is so high. Those are some of the areas that we help with Medicare complaints and appeals. So as you can see, our volunteers do a lot of work because they have to understand all of these components and be able to assist clients that have a range of various scenarios that could connect with any one of these areas mentioned. So let's talk about some recent changes that affect Medicare. We know that if we've been watching the news, we know that Congress passed several bills and you might be sitting in your living room wondering, well, I'm stuck at home. I don't know how these changes affect me. What do they have to do with me anyway? Well, they did affect Medicare somewhat. Some of the rules, they haven't been changed, but they have been relaxed to provide folks assistance to several areas. So some of the recent changes affecting Medicare. First, let's look at the legislative piece. So Congress passed 3 bills and they all affect Medicare in various ways. So there's the coronavirus preparedness bill, there's a Families First, and then there's the one that President Trump signed into law. And then there's a 4th bill that's being debated. And I'm not a legal person, so I'm not going to get into that detail. So the changes that have affect Medicare are these 3 changes. And they're both administrative, and these administrative changes have 2 parts. They're regulatory and then there's sub-regulatory. And you can, and I can make these links available to Brittany and she'll be able to post them later on so our listening audience can go in and connect through these links later on. And I'm not going to go into them in detail, but they're there available for the public to view. So the Medicare waiver rules are the ones that directly impact Medicare patients. And I'm going to focus on just the ones that affect Medicare Advantage plans, affecting possibly skilled nursing services, home health services, and just a tad bit on the Medicaid piece of it. So the Medicare waiver rules, most changes were accomplished or done through waiver rules, which include but are not limited to the expansion of permissible telehealth visits. That's where using an iPad, an iPhone, you're able to connect with your healthcare provider and he can give you details or do a screening using that basis. The flexibilities to hospital, SNF, and other facilities including where services can be provided through waiver of certain notices. Also, since suspension of many reporting requirements, oversight, and activities. Let's talk about the expansion of telehealth. It covers a range of providers and services, including doctors, nursing, or nurse practitioners, clinical psychologists, and licensed social workers. It covers types of routine visits, such as mental health counseling and other preventative screening. As of April 24th, CMS is permitting Medicare Advantage plans to provide smartphones and or tablets as a supplemental benefit to for primary health related purposes. And these details, or more of this detail, can be found at cms.gov. Focusing on skilled nursing facilities and home health, most of us know that unless you have a 3-day prior inpatient hospital stay, you will not be admitted into a nursing home. Sometimes we have seen folks in the past that had 2 nights and they're ready to go, but they have to stay that 3rd night in order to make the qualifier. Well, Medicare has waived this rule. So now, due to COVID, if you need to go, if you're in the hospital and need to go to skilled nursing for further service, for acute care, just for rehab, the 3-day waiver has been waived. We also know that Medicare's rule is that for every well stay, you must have a 60-day in order to regenerate 100 days. So let's say someone exceeds their 100 days and they're not in that new benefit period, that 100-day benefit is being waived by Medicare. So if you're 101 days, you can still stay in the SNF if you're already admitted, or if you're in the hospital, for instance, and you've maxed out your 100 days, you could still be transferred to a skilled nursing for services because of the waiver. Right now, limited surveys are being done only to protect folks, and it's just for infection control. On the home health side, homebound requirements are not waived, but they're loosened. So we know that for you to receive Part B services through home health companies, you must be what they refer to as being homebound. You have specific things you could go out for, such as if you needed to go to your doctor for a follow-up visit, you're allowed to go for your doctor's visit. But what Medicare has said, we understand most folks are homebound and will send nurses out to provide that assistance. We'll even provide nurses' aid assistance, and more of that information can be found on cms.gov. It also allows for occupational speech therapists and other forms of therapists to go in and visit with the patient, again, using universal precautions, going in, visiting with patients, using their Part B services. So if you're at home and your doctor had ordered services for you, whether it be occupational or physical therapy, and you think, oh boy, with COVID, I'm not going to get those benefits, you'll still be able to receive your benefits. So you can have either an original Medicare, kind of like the card that's shown on Brittany's screen. Most folks that have original Medicare are very familiar with that card because that's what they use when they go to their providers. So that's original Medicare. But then there are folks that said, I would like to have a private company manage my insurance. And that's what the Medicare Advantage plan is in short. It's that you have opted, or beneficiaries have opted, to use private insurance companies to manage their Medicare. And those plans vary. They vary across companies. They vary across plans within the same companies. So each person has to consider their option carefully. And that's one of the things that our Shine volunteers help folks navigate. So what did Medicare do with these Medicare Advantage rules? The Medicare Advantage plans must cover benefits at non-contracted facilities. Earlier, I said that these are private insurance companies. Each of these companies have set rules. So they have contracts with particular hospitals. For instance, you could be with ABC Company that is contracted with Bayfront Hospital in our area, for instance, but not contracted with Sarasota Memorial Hospital. Or they could be contracted with Lee Memorial Hospital, but not NCH or the Naples Community Health Center. So you have to look at your plan carefully to see who your providers are and who they're authorized, who you're authorized to use. And what Medicare has says in this current arena, we're going to relax the rules a bit. So if you're signed up with ABC Company, and ABC Company requires you to go to Bayfront only, or Doctors Hospital only, or Sarasota Memorial Hospital only, what they have done is relax the rules so that the closest one with an available bed will be able to admit you without you having to pay extra for that, because we know that would be out of network, and the out of network rule has been relaxed as well. They've waived in full the gatekeeper or the referral requirements. So referral requirements means that you have to meet all of the conditions, the 3-day stay, you have to go to a facility that is contracted with your plan. Those have been waived. Now, they haven't thrown these rules out the window. So don't think because these rules are waived that after COVID and they've lifted the ban that we're not going to go back to the way things were. These rules are relaxed only due to COVID. Let's see what happens after the ban for COVID has been lifted. The Medicare Advantage plans must provide some cost sharing for the same cost sharing for in and out of network. And that happens again because of the benefit relaxation that Medicare has done for both hospitals and SNFs. The Medicare Advantage plans must make changes immediately within 30 days of notification for the reduction in cost sharing waivers and prior authorization. So we know if you're in the hospital and you need to go to a skilled nursing, for instance, that there is prior authorization is needed. So they have waived that requirement. And that's pretty much it. There are certain things related to Medicaid. So if you're on Medicaid, for instance, and you're coming up to your recertification process or period, CMS has also relaxed those rules. And in the state of Florida, those rules have also been relaxed. So if you're coming up to your recertification date, where you would be dropped from your benefits, they're doing auto enrollments for you. So if you contact your local DCF office or just call that toll-free number for DCF, they can tell you when your next recertification date is going to be. So if it's within the next several months, don't be alarmed. There is help out there for you. All of these agencies are working together and working on behalf of each beneficiary. So thank you very much for your time. And if you need to contact us, our local contact number is 1-866-413-ELDER or 1-866-413-5337. It has been a pleasure speaking with you.
Thank you so much. Awesome. All that information is so helpful right now, and I got to learn new things as well as I'm sure our audience listening. I'll make sure I put your information as well in the post for people to reach out to or call in case they have more questions. But Cammie, you've been awesome. Thank you so very much for your time today.
You're welcome, Brittany. It was a pleasure.
All right. Well, everybody, thanks for tuning in. And again, this was Cammie with the SHINE program under Area Agency on Aging, Southwest Florida. And hope everybody has a great rest of their Monday.
You too. Thank you.
Hey, Cammie, you'll just have to end the meeting from the host side.
Okay. Okay, great.
All right. Bye.